are going to learn about the ICD-10-CM classification for diseases of the circulatory system. So in the previous session, we have discussed about I-51 codes. In this video, let's start with I-52 code classification. So what is I-52 and I-5A? So it's a heart diseases, heart disorders in other diseases. So this code, it is used when a heart condition is caused by a disease that belongs in the another ICD-10 chapter. So it is not the circulatory chapter. So think of I-52 as a heart problem due to another non-cardiac disease. For example, cardiac disease, it is caused by the syphilis. So code syphilis first, that is A52.X category code, and then you have to add I52.X. So I5A, it's a non-ischemic myocardial injury. So this is a newer ICD-10 code. It is added to help separate heart injury that is not caused by the ischemia. The name itself tell you the non-ischemic. So what it happens, a troponin is elevated but not due to the myocardial infarction. There will be a no coronary blockage, no ischemia, and this is sometimes called as non-MI troponin elevation. So when you have to use I5A, you have to use whenever the heart muscle injury happens due to stress on the heart, inflammation of the heart, and also the non-cardiac illnesses. And this is not because of the blocked coronary arteries. So what are the common examples of I5A? A sepsis-related myocardial injury and renal failure with the high troponin. In sepsis-related myocardial injury, inflammation plus a shock occurs, which leads to heart muscle damage. Whereas in renal failure with high troponin, you can see kidneys cannot clear troponin over here, and this causes the elevation without the MI. So if troponin rises, IS due to ischemia, then uses the MI codes, not I5A. So in the picture, you can see a myocardial ischemia. So it shows the difference between a healthy and blocked coronary artery. So in a healthy artery, you can see blood flows freely. Heart muscle gets oxygen. Whereas in blocked coronary artery, you can see a fatty plaque over here. Fatty plaque blocks the blood flow and heart muscle becomes damaged. So this is the blocked artery ischemia. And then next, coming to the category codes I-60 to I-69. What are these? Cerebrovascular diseases. So the first code is I-60, subarachnoid hemorrhage. So what do you mean by subarachnoid hemorrhage? It's a bleeding into the subarachnoid space. Subarachnoid space is nothing but this is the area between the arachnoid and pia mater in the brain. So what is the common cause of this SAH? It is usually due to a ruptured cerebral aneurysm. So where the subarachnoid space contains, what does it contains? It contains cerebrospinal fluid. It contains major arteries of the brain. So bleeding here, it spreads quickly. So what are the subcodes of subarachnoid hemorrhage? I-60.0. It's a carotid, siphon and bifurcation SAH. So what are the common examples? A ruptured MCA aneurysm. So whenever ruptured MCA aneurysm is diagnosed, you have to assign the code I-60.1 because MCA has its own code ranges. So spontaneous subarachnoid hemorrhage with no artery specified, you have to assign the code I-60.9. So you have to always use this 0.9 when the documentation doesn't specify the vessel. In the right side, you can see the picture of the subarachnoid hemorrhage. So what does this image shows? It is showing you the aneurysm on a cerebral artery, blood leaking into the subarachnoid space, and a stroke area indicating the irritation and pressure from the blood spread. So this helps you to visualize why subarachnoid hemorrhage causes sudden severe headache, that is thunderclap headache. Okay. And then coming to I-61, it's an intracerebral hemorrhage. So what do you mean by intracerebral word? This code is used for bleeding within the brain tissue itself. Intra means within, right? So within the brain itself, not around it. So I-60 and I-61, the key difference is I-60 is nothing but bleeding around the brain, that is subarachnoid space, whereas I61 is bleeding inside the brain, that is a brain parenchyma. So what are the common causes for these two diseases? You can see the hypertension, AV malformations, trauma, and also the anticoagulant therapy. So subcode of I60 is I61.0, hemorrhaging hemisphere subcortical. So the bleeding is located under the cortex, the white matter region. So this is the subcode of the I61. And then next coming to I62 code. What does it describe? Other non-traumatic intracranial hemorrhage. So what does the meaning say? A bleeding inside the skull but not due to trauma and not due to the subarachnoid hemorrhage. You have to think it as other types of internal head. It bleeds that don't fit into I60 or I61. So what is the subcode example of I62? I62.0 for subdural hemorrhage, which is a non-traumatic. So a subdural hematoma, it forms slowly. It forms often in the elderly patients. So you no need of no history of injury. So what is the example for subdural hemorrhage? A chronic subdural hematoma, which is a non-traumatic one. Okay, it is I62.0. So whenever a subdural hemorrhage non-traumatic is diagnosed, you have to assign the code I62.0. So next I63. So what do you mean by I63? It's a cerebral infraction, nothing but ischemic stroke. So a part of the brain dies because the blood flow is blocked. So this is called as cerebral infraction. So what is the mechanism of this one? Thrombosis and embolism. So thrombosis, it's a local clot, right? So thrombosis, a clot forms right in the artery. So thrombosis of pericerebral arteries, you have to assign the code I63.0. Whereas embolism, I63.1. So this embolism, in embolism, the clot originates elsewhere like atrial fibrillation, and this clot, it gets lodged in the carotid or vertebral circulation. So thrombosis means a clot born here. Embolism means clot flown here. So there is a huge difference in between two words. So next coming to I65 code. It is occlusion and stenosis of the precerebral arteries. So what do you mean by occlusion and stenosis? This artery is supplying the brain or narrowed or blocked, but there is no stroke yet. So arteries supplying the brain are blocked, they do not function. But because of this, there is no effect, there is no stroke. That is the example of the I65. So what is the important distinction of here? If a stroke is present, you have to use code I63 instead. If only narrowing or blockage is found on imaging, then only you have to assign the code I65. So occlusion means it's a blockage or narrowing of the arteries before they enter the skull, but there is no stroke yet. So only vessel disease, no infraction. So if a stroke occurs, you have to code I63, you have not to code I65. So what is the examples of subcode of I65? I65.0. It is occlusion or stenosis of the vertebral artery. So next I66, occlusion and stenosis of the cerebral arteries. In before code you have seen about the vertebral artery. In this you are seeing about the cerebral arteries. So without infraction. So blockage inside the brain arteries, but there is still no stroke. So this is the intracranial version of the I65. So what is the subcode example? I66.0. It is the occlusion of the middle cerebral artery, nothing but MCA. MCA is the most common artery involved. So what is the main difference between I65 and I66? I65 is nothing but it's artery problems before the brain, and I66 artery problems inside the brain. But what is the common point in between two codes? There is no infraction. Okay. And next coming to I67 code. I67 code describes about the other cerebrovascular disease. So what do you mean by this? A miscellaneous category for cerebrovascular conditions. These are not due to bleed for infraction. So this includes things like the vascular malformations. They include vasospasm, dissections, and cerebral arteries. So what is the important subcode? I67.0. It is a dissection of the cerebral arteries, nothing but a tear in the artery wall inside the brain. And then I68 about the cerebrovascular disorders in diseases classified elsewhere. So this is used whenever a cerebrovascular problems they happen due to another primary disease. So this I68 is not the primary code, it is always used as a secondary code. Example, cerebral arthritis due to lupus, you have to assign the code I68.X. So what is the rule of the here? Always you have to code the underlying disease first, then I68.X. So what is I69 code? It's a sequel of cerebrovascular disease. So what is the meaning? A residual symptoms after a previous stroke that has already healed. You're getting my point, right? You can see the residual symptoms after a previous stroke. They have been already healed before itself. So this is like a sequela. Sequela is nothing but the late effect. So when you have to use I69, you have to use for the weakness after the old stroke. You have to use it whenever a speech difficulty from the past stroke, whenever a memory issues takes place due to the old infarct. So this is not used for the active stroke. It is only for the long-term effect. So what is the subcode of I69? I69.0, it is a sequel of SAH. So if the original stroke was ischemic, you have to select the matching I69 subcode. So what is the example? When an old stroke with left hemiplegia, you have to assign the code I69.354. Here I69.35X, it indicates hemiplegia or hemiparesis following the cerebral infarction, whereas 4 indicates the left side affected. And then coming to the category codes, isolated CM ranges from I70 to I79. So what these codes describe? Arterial, arteriolar and capillary disorders. So this block, it covers the diseases of arteries other than the stroke. So what they include? They include arteriosclerosis, peripheral arterial disease, aortic aneurysm and dissection, arterial embolism and thrombosis, arthritis, Raynaud's disease and also the Buerger's disease. So coming to I70, the arteriosclerosis. So what do you mean by arteriosclerosis? A buildup of a plaque. Formation of a plaque inside the arteries is nothing but atherosclerosis. So what does this causes? It causes the narrowing, reduced blood flow and sometimes the clot. At the right side, you can see the image, the normal artery. You can see the plaque formation which is yellow in color. And you can also see the plaque formation, plaque growth and rupture and also the blood clot. Due to the plaque formation, due to its growth and rupture, you can see the formation of the blood clot in this image. So what are the subcodes of arteriosclerosis? I70.0. So this is used whenever the lipid plaque is present in the aorta. So what is the example? Arteriosclerotic changes in the abdominal aorta on CT. You have to assign the code I70.0. So next I70.2. What it describes? Arteriosclerosis of native arteries of the extremities. So this is the most important code for PAD, peripheral arterial disease. So this includes PAD with different severities. For example, what does it include? It includes claudication, wrist pain, ulcers and also the gangrene. So these details usually appear in the I70.20 to I70.29 section depending upon the laterality and symptoms. So these are classified based on their location and side. So I70.20, it is a subcode indicating PAD without ulcer or gangrene. It is nothing but peripheral arterial disease of unspecified extremity. So with no ulcer, with no gangrene. What is the example? Early PAD with leg pain on walking. It is claudication, but there is no wounds. So I70.20, you have to assign the code I70.20. So next I-71, it is aortic aneurysm and dissection. So what do you mean by aortic aneurysm? It's an abnormal dilation or bulging of the aorta. So aortic dissection, it is a tear in the aortic wall. It is causing the blood to split the layers, which is a medical emergency. Based upon location and type, they are classified into the subcodes. I-71.1, it describes about the aortic dissection. So what is the example? It is used for the classic symptoms such as acute tearing chest pain radiating to the back. So whenever a patient is diagnosed with acute tearing chest pain, you have to assign the code I-71.00. And I-72, it is for other aneurysms. So aneurysms in arteries other than aorta. So what do you mean by this? It is used for the aneurysms in any artery except the aorta. So these aneurysms are coded by the body region. So what is the example of the subcode? I-72.0. This is the carotid artery aneurysm. You have to assign the code I-72.0 whenever carotid artery aneurysm is diagnosed. So next coming to I-73, it describes other peripheral vascular diseases. So what does this code includes? This includes the peripheral vascular conditions which are not caused by the atherosclerosis. So what are the examples of these other peripheral vascular diseases? Buck's disease, Raynaud's syndrome, and intermittent claudication. So here you can clearly see a picture of the aortic aneurysm. This is the picture of the aortic aneurysm. So this picture, it shows the aorta and where the aneurysms commonly form. The picture A, it describes about the normal aorta coming out of the heart. So it has thoracic aorta, abnormal aorta in the abdomen, thoracic aorta in the chest, and you can see no bulging, no smooth walls, and resulting in no aneurysm. Next in B, it is a thoracic aortic aneurysm. So this is an aneurysm that occurs in the thoracic aorta, nothing but in the chest aorta. So you can see the bulging or ballooning in the upper part of the aorta. So it is above the kidneys and it is closer to the heart. So ICD-10 code related, so it's just an aneurysm. I-71.2X, it is thoracic aorta aneurysm depending upon the rupture status. So if it's a dissection, you have to assign the code I-71.0. Next coming to C picture, this shows a bulge in the abdominal aorta below the kidneys. So this is the most common type of the aortic aneurysm you can see. So what is the ICD-10 code related to abdominal aortic aneurysm? It is with or without rupture, right? You have to assign the code I-71.3 to I-71.4 for abdominal aortic aneurysm. So examples of the other peripheral vascular diseases, these are Raynaud's syndrome or Buck's syndrome. So coming to Raynaud's syndrome. So what is Raynaud's syndrome? What does it affect? So this condition, it affects the fingers and toes, especially in the cold. So finger color changes in the cold. For example, white to blue, blue to red fingers. You have to assign the code I-73.0 for Raynaud's syndrome. So what happens? This blood vessels, it suddenly gets narrowed. Nothing but you can see the less blood flow. So that the color changes. So whenever it changes to white, it indicates there is no blood flow. Whenever it changes to blue, it indicates it has a lack of oxygen. So red indicates the blood flow returns. So if a note says white, blue, red fingers when cold, you have to assign the code I-73.0. Next, I-74. See, you can also see a picture of the Raynaud's syndrome. Here, skin turning into white, blue, and also the red. So I-74 is for arterial embolism and thrombosis. So this category is for the acute blockages in the artery. So arterial embolism is nothing but it's an acute blockage in the arteries. Embolism versus the thrombosis. So embolism means the clot travels from somewhere else and it blocks an artery. So thrombosis means the clot forms in the artery itself. So what is a subcode example? If a clot travels and blocks blood flow to the leg, you have to assign the code I-74.3. It is an acute limb ischemia. So next, it's I-75, atheroembolism. So what is atheroembolism? What do you mean by it? It is not a big clot. It is not a big clot. It is due to tiny cholesterol crystals breaking off and blocking the small vessels. So what are the common places of the atheroembolism? Skin, kidneys, legs and toes. So what are these example? Subcode example I-75.011. It indicates atheroembolism of the left leg. So whenever atheroembolism of left leg is diagnosed, you have to assign the code I-75.011. So this is about the Raynaud syndrome. So then I-76 category code. So what do you mean by septic arterial embolism? An embolus is a traveling particle. Embolus is nothing but it's a clot or an infected material. So this blocks a blood vessel. Septic means the embolus is caused by the infection. So I-76 is nothing but it is used whenever an infected particle travels in the artery and blocks it. So what is the example of septic arterial embolism? So a patient with infective endocarditis, nothing but it's an infection of the heart walls. So pieces of the infected material break off, then it travels through the bloodstream and then it reaches the fingers so that it blocks the arteries. So this is coded as the I-76. So next I-77, other arterial disorders. So what does this category include? It includes various arterial problems that don't fit under more specific codes. So this includes I-77.0 code for arteriovenous fistula, an abnormal connection between an artery and a vein. So blood flows incorrectly between them. So whenever arteriovenous fistula is diagnosed, you have to assign the code I-77.0. And next coming to I-78. This is a disease of the capillaries. So capillaries are nothing but the smallest blood vessels. What is the subcode of disease of the capillaries? It's I-78.0. It's a hereditary hemorrhagic telangiectasia. So this is a genetic condition wherever small blood vessels are fragile and they bleed easily. So you have to assign the code I-78.0. So next I-79. So I-79 it describes about the disorders of the arteries, arterioles and capillaries in diseases classified elsewhere. Nothing but this means the vascular tissue is secondary to the another disease. This is used when another main disease is responsible for this artery or capillary disorder. So what is the example for I-79? It's an example diabetes causing arthritis. Nothing but inflammation of the arteries. So you have to code I-79.x because diabetes is the main condition. Arthritis is a result of it. So in the right side, you can see the picture of arteriovenous fistula. In this, arteries and veins are present in the arm. A labeled arteriovenous fistula is inserted. So it is abnormal artery vein connection. So you can see the vein enlargement due to the increased blood pressure. You can also see the mixed arterial and venous blood. So this illustration, it supports the understanding of the AV fistula is nothing but I-77.0 code. So this is about the I-76 to I-79 code classification. So this is for today's session. In the next session, you are going to learn about the continuation of the I-79 codes. Thank you.